It'll take just a second to go live. Let's see. Okay, looks like we're live. Hello, everybody. Good morning. And I have, my name's Caroline Hightower, and I am the outreach librarian here at Hampton Down Library. And today we have Dr. Fred Thompson, the director of the Anson County Health Department. And he is with us today specifically talking about COVID-19 and vaccinations. So I know that this is a topic that's constantly changing and evolving. And we are so thankful to have him here to answer some of our questions. So I've got first some informational questions, and then I thought I'd move into some questions that I've heard people ask. And then we can kind of thought we could look ahead to what people can do in the future. So let me make sure that I have, yes, okay, gallery view. Okay, so Dr. Thompson, how many active COVID cases do we currently have here in Anson?
Good morning, Caroline. Thank you for having me. Can you hear me all right?
I can hear you fine.
All right. The question was, how many cases do we have?
Yes.
Since the pandemic began, right, around March of 2020, we've had 2,719 total cases. But most people really want to know how many active cases do we have right now. We currently have 46 active cases, and generally an active case is somebody that's in quarantine, where we monitor them daily, right? And they've gotten the COVID within the last couple of weeks. And then they're in quarantine for at least 10 days from the onset of symptoms, and until they've been fever-free, no fever for at least 2 days, with no fever-reducing medication. So we were, if you go back to April, May, June, you know, we saw a big decline in our number of cases, as did North Carolina and really the whole country. But with the emergence of the Delta, the so-called Delta variant, Anson County, we have experienced an increase in our cases since about July 1st. And I think it's a combination of a little surge from the 4th of July, where people were getting together, and the emergence of the Delta variant. We had 34 new cases this past week, since last Monday.
It's very high.
That's about, 4 to 5 a day. And we were averaging 1 to 2 a day. And that's similar with what we're seeing in other counties and across the state. So that's where we're at with our cases, 46 active. Fortunately, we've not had any deaths in the last month. We've had, unfortunately, 58 deaths since the pandemic began.
How many, do you know how many of the current active cases are people who have not or have been vaccinated? Do you know that?
I maybe one. All of our cases are showing up in people that are unvaccinated.
Gotcha.
We've had just a couple of the so-called breakthrough cases
Mm-hmm.
where people, but those are people, the ones we've had have been where their immune system is compromised, like they're on cancer drugs, or there's some other where they don't have a normal immune system response. But virtually all of our cases are in the unvaccinated. And we're seeing them in younger age cohorts, 30s and 40s, 20s. Most of our older, once you get above 55, I think 55 and above, we have like 85% of Ansonians in that older age groups are vaccinated. So the cases we're seeing are in the unvaccinated and in younger age groups.
So with the vaccines, how many different vaccines for COVID-19 do we currently have in the US and then available here in Anson?
As I'm sure most of your listeners know, there are currently 3 vaccines approved for use in the United States. All of them have under the emergency use authorization. The Pfizer vaccine is available for 12 and up. The Moderna for 18 and up, which is what we offer here at the health department. And then you have the Johnson & Johnson single dose vaccine, which is approved for 18 and over. So Moderna and Johnson & Johnson are approved for 18 and over. Right now, the only one approved for 12 and over is the Pfizer. Locally, our local CVS pharmacy offers the Pfizer vaccine for the 12 and over. Our grandson, for example, is 15, and he was vaccinated here at our local CVS with the Pfizer.
So how effective is the vaccine?
All 3 of the major vaccines are very effective. You know, there's different ways to measure that, and people have a tendency, I think, to get hung up on the numbers. No vaccine is 100% guarantee, right? And you can never get to 0 risk. But if you look at the Pfizer and the Moderna and Johnson & Johnson, they are in the mid 90% effective from preventing you from getting the COVID. But even perhaps more importantly, they've been shown to be almost 100% effective from keeping you out of the hospital, keeping you out of ICU, and keeping you from dying. Another way I look at the effectiveness of the vaccine, you know, the vaccines came out right around last Christmas
Dana,
time.
you have a call parked on line 5, please. Dana, line 5.
And prior to that, we had outbreaks in both of our local nursing homes, at the assisted living center here in Anson County. But we've not had an outbreak in one of the nursing homes in months. And that's because all of the residents are vaccinated and the staff is vaccinated. And to me, that's really clear evidence of how effective the vaccines are, where you have 100 residents living together at that nursing home, plus the staff members coming and going every day. And we haven't had an outbreak in several months. So everything that I have seen the vaccines are very, very effective.
And I think you may have already mentioned this, but what percentage of Ansonians are fully vaccinated at this point?
In Anson County, 37% of our total county population. You know, we have about 25,000 people in the county, and 37% are fully vaccinated. And then right behind that, about 34% are, and so
That seems so low, doesn't it?
If you look at North Carolina, it's about 55% of people 12 and over. If you look at a lot of the counties around us, Stanley County, Richmond County, they're right around where we are, somewhere in that 34, 35, 36, 37%. A couple things to remember when you think about the 37%, right? Remember that about 11% of our county population is under the age of 12, so they're not eligible, right?
Mm-hmm.
So that would take you up to around 47%, 40, somewhere in there. And then you have 11 or 12%, as I mentioned, that 2,719 local Ansonians, right, that have had the COVID. So if you add those three numbers together, you're at around 60% of the population that have either had it, been vaccinated, or they're not eligible for the vaccine yet because they're under 12. So we're talking about, in round numbers, about 40% of eligible people in Anson County that are eligible for the vaccine that have not gotten it. So if you look nationally, I think the number is about 67% of Americans 12 and over have gotten at least the first shot. So I would like to see more of our unvaccinated people, and at the risk of repeating myself, the 34 cases over the last week, what we have right now, Caroline, is really, as the CDC says, a pandemic of the unvaccinated. And so we are vaccinated here at the health department on Tuesdays, right? Tomorrow. No appointment is needed. We're taking walk-ins. And I think last Tuesday we had scheduled appointments, right? And also walk-ins. And I think last Tuesday we had 21 people walk in addition to the scheduled appointments. So my message, the vaccines are safe and effective. And you need to protect, you know, there's several advantages to being vaccinated. First of all, it might save your life, right? Secondly, if you're fully vaccinated, in most settings, you don't have to wear a mask. You can travel if you're fully vaccinated. You don't have to quarantine before or after you travel. Another big benefit of being vaccinated, if you're fully vaccinated and you are exposed to an active case, you don't have to quarantine. And so those to me, are some pretty significant benefits. And you're protecting your family, particularly if you have children in the household under the age of 12 that are not eligible to be vaccinated. So I encourage everyone that's eligible to get vaccinated and to do it now, not to wait.
So speaking to, you mentioned the children and how they are not able to get vaccinated. When do you think they might approve the vaccines for them for emergency use?
The only honest answer is that I don't know. So you end up speculating. All three, Johnson & Johnson, Moderna, and Pfizer, are being tested clinical trials in children as young as 6 months old. I anticipate that at least one of the vaccines will be approved for children, say 5 and up, by the end of this calendar year.
Mm-hmm.
But again, I'm only speculating. We'll see.
And then I know that the school board met, I think not too long ago here in Anson County. Have they come up with a policy for the coming school year that you know of?
Misty, line 7. Misty, you have a call parked on line 7, please.
Yes, you are correct. They met last Monday, and they have decided, they voted to follow the CDC guidelines that came out last Wednesday afternoon. And as I'm sure everybody knows by now, the CDC is recommending that all children need to be in person in the classroom. And primarily because the 12 and under
Triage, line 1.
are not
Triage, you have a call
eligible
parked on line 1.
to be vaccinated. The CDC is recommending that students and staff, regardless of vaccination status, wear a mask, a face covering in school. Anson was one of the very first school districts to vote to require masks in school. I think on Friday, Charlotte Mecklenburg voted to require masks in schools. I think that was driven a lot by the CDC recommendations that came out on Wednesday afternoon. Richmond County schools have voted to require masks. Having said that, as you probably know, Governor Cooper's mandatory mask mandate expired Saturday, July 31st. And it's mask optional. Governor Cooper strongly supports the CDC, and the Strong Schools, it's called Strong Schools Toolkit from the Department of Health and Human Services, guidelines for management of the COVID and safety precautions in schools. The Strong Schools Toolkit was updated to recommend students and staff to wear masks. A lot of school districts have voted to make masks optional. I'm sure it's been in the news, so I know everybody's is aware of that. Most of the school districts are going to require masks on the school bus, but a lot of them in the classroom setting, it's mask optional. I think some school districts that have not voted yet will probably follow Charlotte, Mecklenburg, Anson, Richmond in requiring masks for students and staff based, regardless of vaccination status, based on the new CDC guidelines. And again, the reason for that is that the 12 and under, the children under 12 are not eligible to be vaccinated. And so the concern is those children under the age of 12 and protecting them. So the recommendation is that students, staff, regardless of vaccination status, wear masks at school. Some people feel very strongly, emotions are high on both sides of the issue.
Mhm. So I have collected some questions of different things I've heard people ask, or maybe I've had a friend or a family member that had these questions. And so I thought I would just kind of throw them out there and you can answer them, because as my dad always says, there's only one wrong question, the one you don't ask. So, so one thing I've heard people say is, I've never had a flu shot and I have never gotten the flu. So why should I get this shot?
The coronavirus is not the flu. It's more deadly. Particularly this Delta variant is much more contagious. And you think of just using Anson County as an example, we've lost 58 people in the last 12 months to the coronavirus. We might lose 3 to 5 to the flu. So you're doing it to protect yourself, but the people that you work with, the people that you live with, you're protecting them also. And so comparing the coronavirus vaccine and the flu, they're really different. And there will come a time when we move beyond the pandemic and where the coronavirus is, they call it endemic in society all the time, like the flu. You can get the flu anytime, year round. We do have a quote flu season starting in about October, and you get your annual flu shot, October, November, December. And at some point, we'll get there with the coronavirus, but we're not there now.
I've heard this quite a bit. I take care of myself and my immune system by eating healthy and exercising. I'm not at risk. I'm not going to get the vaccine.
I can understand that perspective. I'm young, I'm healthy, but I can tell you the 34 cases we've had in the last 7 days, almost all young, healthy people. The Delta variant, and by the way, all of those new cases were told, we are not told it's the Delta variant or some other variant, but we're being told by the state epidemiologists that we should assume now that all of our new cases are Delta variant. And by the end of July, the expectation was that virtually 95% or more of new cases would be the Delta variant. And that's where we're at. It's clear when you look where we were only getting one case a day, maybe 2 cases. Now we're getting 4 or 5 a day. What's the difference? Well, the difference is the Delta variant. and it's much more contagious than the original virus. And the virus is constantly mutating. And we had the so-called British variant, the B.1.1.7. Then we had the variant from India, South Africa. Now it's the Delta variant. And the Delta variant is far and away our most contagious that we've seen. So and I don't want to repeat myself, you're getting vaccinated to protect yourself, but also so that you're not transmitting that virus to other people that they're not vaccinated. And everybody has seen on the news where they have these so-called super spreader events where you have hundreds or even thousands of people together, and all of a sudden there's a huge outbreak. Like we're seeing in Florida, where you have a lot of people from all across the country going to Florida for vacation. They're together at these parties and what have you. And the virus is spreading very, very quickly among the unvaccinated. So even if you're young and healthy, you need to get vaccinated.
Something else I've heard a lot of people say is the vaccine hasn't been studied enough. I don't trust it that it's safe.
The vaccines, all three of them, went through the same clinical trial as any other vaccine. And Moderna is a good example. They will all, they just cut the bureaucracy and cut but they all went through the same clinical trial workup as any other vaccine. And we have administered thousands of the Moderna here at the health department since they came out around Christmas time. And I can count on one hand, we've not had any really. People are doing really well. They get the first shot, come back 27 days later, 28 days later, get the second shot. The vaccines are both safe and effective.
So I heard one person ask this question. How is the vaccine linked to the AIDS virus?
It's not. I think that's either some people would call it fake news or there's no relationship.
So I've also heard people say, well, I've had COVID, so I already have immunity. I don't need the vaccine.
That's a good point. And for the most part, I would agree with them. Different epidemiologists take a different position about natural immunity versus immunity you get from being vaccinated. And it's really, if you've had the COVID, it's really a one-on-one discussion with your doctor about whether or not you need to get vaccinated. A lot of physicians will say, if it's been at least 3 months, right? 3 months since you've had it, you should probably go ahead and get the vaccine. And you'll have a much better chance also of not getting it again. And if you have underlying medical conditions, you've had a heart attack, cancer, whatever, a lot of doctors will recommend that you go ahead and get vaccinated, even if you've had it because your immune system is not as robust as the young, healthy people that you were asking me about a couple minutes ago. So most people that have had the COVID, it really comes down to talking with your doctor about whether or not you need to get the vaccine.
What about people that say, well, I took the flu shot and I got the flu. If I get the vaccine, will it make me sick?
The first thing I would say is, and the flu shot is a good example. No vaccine is 100%, right? You can never get to zero risk. But the COVID vaccines are in 95% effective against keeping you from getting the vaccine. But more importantly, they're almost 100% effective keeping you out of the hospital, keeping you out of ICU. So, and we don't have time and people would be bored to death, but there's a big difference between the flu vaccines, the way they're made in chicken eggs versus the COVID vaccines. The COVID vaccines are much more targeted, much more effective than the flu shot. It's really hard to compare the two because they're made differently. Your flu shot might be very effective one year, depending on the strain of the flu that's prevalent at that particular year, or it may not be so effective. But the COVID vaccines are very effective, particularly, and again, I'll go back to our nursing homes. We've not had an outbreak in the nursing homes in months. That's really striking evidence of just how effective they are.
Let's see. So going back to, how concerned should I be about the new variants? And will the vaccine protect me from them too?
I think if you haven't been vaccinated, right? You're over 12 and you haven't been vaccinated, particularly if you work, if you're going to be going to college, you should be very concerned about your unvaccinated status and the Delta variant, because the Delta variant is much more contagious and spreads much more quickly than the original strain of the coronavirus. So if you are unvaccinated, then you need to continue to wear a mask when you leave your home, right? To protect yourself. You need to practice your social distancing, wash your hands frequently. If you are unvaccinated, you should not be gathering indoors with groups of unvaccinated people. That is a surefire way that you're going to get the vaccine. If you are unvaccinated, the CDC recommends that you do not travel. So you should get vaccinated.
Some people are wondering, is this going to end up being something that you have to get annually, sort of like a flu shot?
There's a lot of debate, and probably the best answer is the jury is still out. What I'm hearing from the epidemiology section in Raleigh is probably. Probably at some point you will need a booster shot, but I don't know that to be a fact. What we're being told now is we'll see. And I don't look for the need for a booster shot until sometime next year, if in fact you will need a booster shot. We also hope that we will move, as I mentioned, we'll get through the pandemic and the virus will be endemic, circulating in the population all the time, sort of like the flu virus. And probably we will stop vaccinating every week and move to a more seasonal vaccination campaign, sort of like the flu shot. And we hope that by 2023, not 2022, but we hope that by 2023, the flu shot and the coronavirus shot might be combined into a single shot. So you would only have to get the one. But right now, as we speak, booster shots are not required. And they're still studying what degree of the protection do you have after 3 months, over time, before a decision is made about a booster shot. We'll see. The only honest answer is I'm not sure.
Mm-hmm. So a lot of people are hesitant because the FDA has only cleared it for emergency use. Do we have any idea when the FDA will fully approve it?
I think full approval for the Pfizer vaccine is imminent within a matter of weeks. And I think for the Moderna and Johnson & Johnson, it'll be within the next six months. I think there's been sort of a overemphasis on the emergency use authorization versus fully. That's just a mechanism that's used to get the vaccines out, and the vaccines are safe and effective. They all went through the clinical trials as any other vaccine. So I anticipate all three of them will be fully authorized. It's just a question of how many months before the CDC does that.
Somebody asked, why do you think so many people are so hesitant about getting the vaccine? Why are they willing to put themselves and their loved ones at risk?
A lot of people just don't like shots, right? They don't like getting stuck with a needle. There's a difference, and the reasons are specific to that individual person. They may feel that the vaccines were rushed. They don't like taking a vaccine that is not fully authorized. It's emergency use authorization. Some people have said, once it's fully authorized, I'll take it. Some people don't trust the government, don't trust the CDC. Some people, as you mentioned, are young, healthy, exercise, eat well, and don't see the need to get the vaccine. Some people feel, I want natural immunity. I'm better off to just go, it'll be like getting the flu, and then I'll have natural immunity. So there's a variety of reasons. Also, I think there's been the best of intentions from the CDC, but the way some of the guidelines keep changing, if you're fully vaccinated, you don't have to wear a mask. Well, now you have to wear a mask in school. And the CDC is recommending now that larger employers, we've already seen this, Google, Walmart, Apple, the employees have to declare their vaccination status. If they're not vaccinated, they have to wear a mask at work. Some employers, particularly large healthcare systems like Atrium Health, Novant, are mandating the vaccine. And so people don't like mandates, understandably. And so there's some resistance there. So there's a variety of reasons, I think, that you see vaccine hesitancy.
One of my big concerns, or my biggest concern, is it worries me that if we don't have a large enough of the population vaccinated, is there a possibility that the virus would evolve past where we were able to take care of it, past where our vaccines are able to cover it?
I'm not being told that. I'm not an epidemiologist. We have seen multiple variants, and the virus will continue to mutate. But so far, all three vaccines have been shown to be very effective against the Delta variant and very effective against keeping you out of the hospital, keeping you out of ICU. I don't see the emergence of a coronavirus where the vaccines are not effective. But I'm sure there are many people that wonder about that, because this has been going on for a long time now. We're into the second year of this pandemic. But short answer, I don't think so. I think if you're fully vaccinated, your family members are fully vaccinated, you're in a good spot.
So looking ahead, so if I am fully vaccinated, what safety precautions should I be taking to keep myself and others safe?
If you're vaccinated or not.
Fully vaccinated.
If you're fully vaccinated, I would recommend that you follow the CDC guidelines. So, for example, when you go to the hospital, even though you're fully vaccinated, you're going to have to wear a mask. Now, with the new CDC guidelines that came out last Wednesday, in some school settings, on the school bus, and in Anson County specifically, if you work in the school system, you're going to be required to wear a mask. If I'm fully vaccinated, I'm going to limit my exposure, if I can, around when I'm indoors with a group of unvaccinated people. If I, for the most part, but if you're fully vaccinated, you shouldn't need to wear a mask in most settings, unless you're in a specific, like a hospital or for example, when you come to the health department, even though we're fully vaccinated, we still wear a mask when we're treating patients.
What about if I'm partially vaccinated? What safety precautions should I be taking?
When you get your first shot, you know, the Moderna is a 2-shot. You get the first shot, and then 28 days later, you get the second shot, or 21 days later. And you should, if you're partially vaccinated, you follow the same precautions as the unvaccinated, right? Until 2 weeks after you've gotten your second shot. So you would wear your mask when you're outside of your house, social distance, wash your hands frequently. You would follow the same precautions as the unvaccinated until 2 weeks after you get your second shot.
So if I'm not vaccinated, or if I choose not to be vaccinated, what should I do to protect myself and people around me?
If you are not going to get vaccinated, you've made that decision, then you need to wear a face covering when you leave your home. You need to avoid gathering indoors with unvaccinated people. You need to be quarantined if you're not vaccinated and you are exposed to an active case. You need to be quarantined until you have a negative test. And if you're unvaccinated, you need to either not travel or have a negative test within 48 hours before you do travel. And as I'm sure you know, there are some public transportation cruise ships that are requiring vaccination. Most of the cruise ships now, you have to be vaccinated. But if you're not vaccinated, it's really pretty simple. If you're not vaccinated, you're going to mask up, social distance, practice the 3 Ws indefinitely until this pandemic is behind us and you're no longer at risk.
So there's the information is constantly changing because the virus is evolving and the news changes daily. So how do we know that the information that we're receiving is accurate or from a credible source?
We update our information on our Facebook page pretty much every day with the new cases and new guidelines. The health department's Facebook page is a good source. We live in a digital world today, Caroline. Most people get their information, or at least a lot of their information from social media and the internet. My recommendation is that people go to the Department of Health and Human Services website, the COVID Information Hub. If you just Google North Carolina COVID Information Hub, it takes you right there. You can see the number of cases by individual county, the vaccination rates by individual counties, all the updates from the CDC. The CDC website is an excellent source of information. I just would caution people to be careful with what they see on Twitter and some of the other social media websites. If it doesn't sound right, it's probably not right.
So if I still have questions, who can I contact to have those questions answered?
I thought you'd never ask. We have a full-time communicable disease nurse. Her name is Misty Puckett. Misty is an excellent source of accurate, up-to-date information. She's constantly getting updates pretty much every day from the communicable disease branch in Raleigh. And her direct line is 704-994-3355. So if people still have questions, they can call Misty and she'll be happy to answer their questions.
Okay, well, wonderful. And that's all that I have. Do you have anything that you'd like to add?
No, I think we've been going for about 45 minutes now, so people are probably, I just want to close with the way I started. It is really important, and I'm speaking to our unvaccinated, we really have a pandemic now of the unvaccinated. And the vaccines are safe, they're effective. Something I haven't mentioned, they're free. There's no out-of-pocket costs, they're free. I encourage people that have, some people said, I'm gonna wait a couple months, or I'm gonna wait 3 months and see how Caroline Hightower does. And maybe if she does okay, I'll get vaccinated. So we've been administering the vaccines now since Christmas. And so for people that were waiting for a while, the time is now. Get vaccinated. Come over tomorrow. We vaccinate every Tuesday, no appointment needed. Just come on over and we'll take care of you.
Well, thank you so much for being with us. I appreciate it. And I hope everybody out there has gotten some wonderful information. It's been very informative. And I hope that everybody will go and get vaccinated. I think it'll make all of our lives easier.
Copy that. Thank you, Caroline.
Thank you.
Bye now.
Bye.